Question 1. A client presents to the emergency department with severe chest trauma after a motor vehicle collision. Assessment reveals BP 78/46 millimeters of mercury, heart rate 138 per minute, RR 34 per minute, tracheal deviation to the left, absent breath sounds on the right, and distended neck veins. Which action should the nurse anticipate implementing first? A. Obtain a stat chest X-ray. B. Administer IV fluid bolus. C. Prepare for needle decompression. D. Apply high-flow oxygen. Answer: C. Prepare for needle decompression. Rationale: the client has classic signs of tension pneumothorax, hypotension, tracheal deviation, JVD, absent breath sounds. Immediate needle decompression is required to relieve life-threatening pressure before imaging or fluids. Question 2. A client with septic shock received 3 liters of isotonic fluids. Current findings: BP 82/50 millimeters of mercury, MAP 58 millimeters of mercury, heart rate 122 per minute, lactate 6.0 millimoles per liter, urine output 10 milliliters per hour. Which prescription should the nurse implement next? A. Administer IV hydrocortisone. B. Start norepinephrine infusion. C. Obtain repeat blood cultures. D. Administer acetaminophen. Answer: B. Start norepinephrine infusion. Rationale: after adequate fluid resuscitation, persistent hypotension requires vasopressor support. Norepinephrine is first line to restore perfusion. Question 3. A client with diabetic ketoacidosis has glucose 740 milligrams per deciliter, potassium 6.2 milliequivalents per liter, pH 7.08, BP 90/54 millimeters of mercury, heart rate 126 per minute. Which prescription should the nurse implement first? A. Start IV regular insulin infusion. B. Administer IV sodium bicarbonate. C. Initiate 0.9% normal saline bolus. D. Administer potassium replacement. Answer: C. Initiate 0.9% normal saline bolus. Rationale: in DKA, fluid resuscitation is the first priority to restore circulatory volume before insulin therapy. Insulin without fluids can worsen hypotension. Question 4. A postoperative thyroidectomy client suddenly develops inspiratory stridor, restlessness, and oxygen saturation 86%. Which action should the nurse take first? A. Check calcium level. B. Prepare for emergency airway management. C. Reposition to semi-Fowlers. D. Notify the provider. Answer: B. Prepare for emergency airway management. Rationale: stridor indicates airway obstruction. Airway management takes priority over labs or positioning. Question 5. A client receiving a blood transfusion develops fever, flank pain, hypotension, and dark urine 10 minutes after initiation. Which action is priority? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Administer IV antihistamines. D. Obtain urine specimen. Answer: B. Stop the transfusion immediately. Rationale: these findings indicate acute hemolytic reaction. Immediate discontinuation prevents further hemolysis and shock. Question 6. A client with acute myocardial infarction suddenly becomes unresponsive. The monitor shows ventricular fibrillation. What is the nurse's first action? A. Administer epinephrine. B. Begin chest compressions. C. Defibrillate immediately. D. Intubate the client. Answer: C. Defibrillate immediately. Rationale: ventricular fibrillation is a shockable rhythm. Immediate defibrillation is the priority intervention. Question 7. A client with anaphylaxis after IV antibiotic administration has BP 70/40 millimeters of mercury, wheezing, and facial swelling. Which prescription should the nurse implement first? A. Administer IV diphenhydramine. B. Administer IN epinephrine. C. Start IV fluids. D. Apply oxygen. Answer: B. Administer IM epinephrine. Rationale: epinephrine reverses airway edema and vasodilation rapidly and is first-line treatment in anaphylaxis. Question 8. A client with severe asthma exacerbation is restless, using accessory muscles, RR38 per minute, and now has diminished breath sounds, silent chest. Which action is priority? A. Administer nebulized albuterol. B. Prepare for intubation. C. Administer IV corticosteroids. D. Encourage coughing. Answer: B. Prepare for intubation. Rationale: silent chest indicates impending respiratory failure. Immediate airway support is required. Question 9. A client with massive upper GI bleed has BP 84/48 mm of mercury, HR 132 per minute, cool extremities, and hematemesis. Which action should the nurse implement first? A. Prepare for endoscopy. B. Insert large-bore IV lines. C. Administer proton pump inhibitor. D. Obtain consent for surgery. Answer: B. Insert large-bore IV lines. Rationale: circulatory stabilization with rapid IV access is the priority before definitive treatment. Question 10. A client with head trauma has ICP 28 mm of mercury, BP 160/60 mm of mercury, HR 48 per minute, irregular respirations. Which action is priority? A. Suction airway. B. Lower head of bed. C. Administer IV mannitol. D. Provide pain medication. Answer: C. Administer IV mannitol. Rationale: Cushing's triad indicates increased ICP. Mannitol reduces cerebral edema urgently. Question 11. A client with pulmonary embolism becomes hypotensive, BP 76/44 mm of mercury, and confused. Which intervention is priority? A. Start heparin infusion. B. Administer oxygen via non-rebreather. C. Prepare thrombolytic therapy. D. Obtain CT scan. Answer: B. Administer oxygen via non-rebreather. Rationale: airway and oxygenation are always first priority in acute deterioration. Question 12. A postpartum client saturates 2 pads within 15 minutes. Fundus is boggy and deviated. What is the first action? A. Administer oxytocin. B. Massage the fundus. C. Insert Foley catheter. D. Prepare for transfusion. Answer: B. Massage the fundus. Rationale: uterine atony is most common cause of postpartum hemorrhage. Fundal massage is immediate intervention. Question 13. A client with potassium 6.8 milliequivalents per liter shows peaked T waves and widened QRS complexes on ECG. Which prescription should the nurse implement first? A. Administer IV insulin with dextrose. B. Administer sodium polystyrene sulfonate. C. Administer IV calcium gluconate. D. Administer furosemide. Answer: C. Administer IV calcium gluconate. Rationale: calcium stabilizes the cardiac membrane immediately and prevents fatal arrhythmias before potassium is shifted or eliminated. Question 14. A client with spinal cord injury at C3 arrives with shallow respirations and oxygen saturation 82%. Which action is priority? A. Apply oxygen via nasal cannula. B. Prepare for intubation. C. Insert Foley catheter. D. Start IV fluids. Answer: B. Prepare for intubation. Rationale: high cervical injuries compromise diaphragmatic function. Airway control is the immediate priority. Question 15. A client with septic shock develops mottled skin, MAP 55 mm mercury, and lactate 7.2 millimoles per liter, despite fluids and vasopressors. Which action is priority? A. Increase vasopressor dose per protocol. B. Administer acetaminophen. C. Recheck temperature. D. Decrease IV fluids. Answer: A. Increase vasopressor dose per protocol. Rationale: persistent hypotension requires escalation of vasopressor support to maintain organ perfusion. Question 16. An opioid overdose has RR 6 per minute, oxygen saturation 78%, and pinpoint pupils. Which action is priority? A. Administer IV naloxone. B. Apply oxygen. C. Prepare for intubation. D. Start IV fluids. Answer: A. Administer IV naloxone. Rationale: naloxone reverses respiratory depression rapidly and is first-line treatment. Question 17. An eclampsia client begins seizing. Which prescription should the nurse implement first? A. Administer IV diazepam. B. Administer IV magnesium sulfate. C. Administer hydralazine. D. Insert Foley catheter. Answer: B. Administer IV magnesium sulfate. Rationale: magnesium sulfate is first line for seizure control in eclampsia. Question 18. A client with ARDS has PaO2 52 mm of mercury on high-flow oxygen. Which intervention is priority? A. Increase oxygen concentration. B. Prepare for mechanical ventilation with PEEP. C. Encourage coughing. D. Administer bronchodilators. Answer: B. Prepare for mechanical ventilation with PEEP. Rationale: severe hypoxemia, unresponsive to oxygen, requires ventilatory support with PEEP. Question 19. A client with tension hemothorax presents with hypotension and absent breath sounds. Which action is priority? A. Insert chest tube. B. Administer analgesics. C. Apply oxygen. D. Obtain CT scan. Answer: A. Insert chest tube. Rationale: immediate decompression restores lung expansion and improves circulation. Question 20. A client with SVT has HR 190 per minute and BP 70 by 40 mm of mercury. Which action is priority? A. Vagal maneuvers. B. Adenosine. C. Synchronized cardioversion. D. Amiodarone. Answer: C. Synchronized cardioversion. Rationale: unstable tachycardia requires immediate synchronized cardioversion. Question 21. A client with acute epiglottitis has drooling, stridor, and sits leaning forward. Which action is priority? A. Inspect throat with tongue depressor. B. Obtain throat culture. C. Prepare for controlled intubation. D. Administer oral antibiotics. Answer: C. Prepare for controlled intubation. Rationale: airway obstruction risk is high. Manipulating the throat may cause complete airway collapse. Question 22. A client with DIC has oozing IV sites and platelets 18,000 per millimeter cubed. Which intervention is priority? A. Administer IM injection. B. Apply bleeding precautions. C. Encourage ambulation. D. Start aspirin. Answer: B. Apply bleeding precautions. Rationale: severe thrombocytopenia increases hemorrhage risk. Question 23. A client with acute pancreatitis develops BP 82 by 48 mm of mercury and HR 130 per minute. Which action is priority? A. NPO status. B. IV fluid resuscitation. C. Morphine. D. Antiemetics. Answer: B. IV fluid resuscitation. Rationale: pancreatitis causes massive third spacing. Circulatory support prevents shock. Question 25. A client with Addisonian crisis has BP 74 by 38 millimeters of mercury and glucose 58 milligrams per deciliter. Which prescription is priority? A. Administer IV hydrocortisone. B. Restrict fluids. C. Administer insulin. D. Give potassium. Answer: A. Administer IV hydrocortisone. Rationale: steroid replacement reverses adrenal crisis and shock. Question 26. A client with carbon monoxide poisoning has confusion and cherry red skin. Which action is priority? A. Administer 100% oxygen. B. Obtain ABG. C. Insert IV. D. Monitor ECG. Answer: A. Administer 100% oxygen. Rationale: high-flow oxygen displaces carbon monoxide from hemoglobin immediately. Question 26. A client with massive stroke suddenly becomes lethargic with unequal pupils. Which action is priority? A. Lower BP. B. Administer aspirin. C. Prepare for emergent CT scan. D. Increase IV fluids. Answer: C. Prepare for emergent CT scan. Rationale: sudden neurochanges suggest hemorrhage. Immediate imaging guides life-saving intervention. Question 27. A client with severe sepsis develops urine output 8 milliliters per hour. Which action is priority? A. Administer diuretics. B. Increase IV fluids per protocol. C. Restrict fluids. D. Insert Foley catheter. Answer: B. Increase IV fluids per protocol. Rationale: low urine output indicates poor perfusion. Fluid optimization is needed. Question 28. A client with hypermagnesia has absent deep tendon reflexes in RR 8 per minute. Which action is priority? A. Administer magnesium. B. Administer IV calcium gluconate. C. Start insulin. D. Give potassium. Answer: B. Administer IV calcium gluconate. Rationale: calcium reverses magnesium toxicity effects. Question 29. A client with compartment syndrome reports increasing pain unrelieved by opioids and numbness. Which action is priority? A. Elevate limb. B. Apply ice. C. Loosen constrictive dressing. D. Encourage ambulation. Answer: C. Loosen constrictive dressing. Rationale: removing restriction reduces pressure and prevents tissue necrosis. Question 30. A client with severe hypoglycemia is unconscious. Glucose 32 milligrams per deciliter. No IV access. Which action is priority? A. Oral glucose. B. IM glucagon. C. Insulin. D. IV fluids. Answer: B. IM glucagon. Rationale: without IV access, glucagon raises glucose rapidly. Question 31. A client with acute laryngeal trauma has hoarseness, stridor, and subcutaneous emphysema of the neck. Which action should the nurse implement first? A. Apply warm compresses to the neck. B. Prepare for emergency intubation. C. Obtain a lateral neck X-ray. D. Encourage coughing and deep breathing. Answer: B. Prepare for emergency intubation. Rationale: stridor and subcutaneous emphysema indicate airway compromise. Securing the airway is the immediate priority before diagnostic imaging. Question 32. A client with massive pulmonary embolism suddenly becomes unresponsive and pulseless. The cardiac monitor shows pulseless electrical activity, PEA. Which action should the nurse take first? A. Defibrillate immediately. B. Administer IV amiodarone. C. Begin high-quality chest compressions. D. Prepare for thrombolytics. Answer: C. Begin high-quality chest compressions. Rationale: PEA is a non-shockable rhythm. Immediate CPR is the priority to maintain circulation. Question 31. A client with diabetic ketoacidosis receiving insulin infusion develops blood glucose 210 milligrams per deciliter, potassium 3.1 milliequals per liter, and muscle weakness. Which prescription should the nurse implement first? A. Increase insulin rate. B. Administer IV potassium replacement. C. Stop IV fluids. D. Administer sodium bicarbonate. Answer: B. Administer IV potassium replacement. Rationale: insulin drives potassium into cells, causing hypokalemia. A potassium of 3.1 milliequals per liter places the client at risk for fatal arrhythmias and must be corrected immediately. Question 34. A client with acute MI develops sudden shortness of breath, pink frothy sputum, BP 88/52 millimeters per mercury, and crackles throughout the lung fields. Which action is priority? A. Administer IV fluids. B. Place client flat. C. Apply high-flow oxygen and prepare for ventilatory support. D. Encourage oral fluids. Answer: C. Apply high-flow oxygen and prepare for ventilatory support. Rationale: findings indicate acute pulmonary edema with cardiogenic shock. Oxygenation and ventilatory support take priority. Question 35. A trauma client with suspected internal bleeding has BP 70/38 millimeters per mercury, HR 142 per minute, and cool, clammy skin. Which action should the nurse implement first? A. Prepare for CT scan. B. Insert 2 large-bore IV catheters. C. Administer morphine. D. Insert Foley catheter. Answer: B. Insert 2 large-bore IV catheters. Rationale: rapid vascular access is essential for rapid fluid and blood resuscitation in hemorrhagic shock. Question 36. A client with severe asthma is intubated and suddenly develops high peak airway pressures and hypotension. Breath sounds are absent on the right. Which action is priority? A. Increase sedation. B. Suction the tube. C. Prepare for needle decompression. D. Administer bronchodilator. Answer: C. Prepare for needle decompression. Rationale: these findings suggest tension pneumothorax, a life-threatening complication requiring immediate decompression. Question 37. A client with heat stroke has temperature 41.5 degrees Celsius, 106.7 degrees Fahrenheit, confusion, and hypotension. Which action is priority? A. Administer antipyretics. B. Initiate rapid cooling measures. C. Obtain blood cultures. D. Encourage oral fluids. Answer: B. Initiate rapid cooling measures. Rationale: heat stroke requires immediate external cooling to prevent organ failure. Antipyretics are ineffective. Question 38. A client with meningococcal meningitis develops petechiae, hypotension, and altered mental status. Which action is priority? A. Administer IV broad-spectrum antibiotics. B. Lower the lights. C. Provide acetaminophen. D. Encourage oral intake. Answer: A. Administer IV broad-spectrum antibiotics. Rationale: rapid antibiotic administration is critical to prevent septic shock and death. Question 39. A client with acute renal failure has potassium 7.0 milliequivalents per liter and ECG changes. Which intervention should the nurse implement first? A. Administer sodium polystyrene. B. Administer IV calcium gluconate. C. Restrict dietary potassium. D. Prepare for dialysis. Answer: B. Administer IV calcium gluconate. Rationale: Calcium stabilizes the myocardium immediately and prevents lethal arrhythmias before definitive potassium removal. Question 40. A client with cervical spine injury develops bradycardia, HR rate 38 per minute, and hypotension, BP 80/46 millimeters of mercury. Which prescription should the nurse implement first? A. Administer atropine. B. Start dopamine infusion. C. Increase IV fluids. D. Obtain ECG. Answer. A. Administer atropine. Rationale. Neurogenic shock causes severe bradycardia due to unopposed vagal tone. Atropine corrects life-threatening bradycardia. Question 41. A client with diabetic ketoacidosis suddenly becomes lethargic with headache and decreasing level of consciousness during treatment. Which complication should the nurse suspect and address first? A. Hypoglycemia. B. Cerebral edema. C. Hyperkalemia. D. Fluid overload. Answer. B. Cerebral edema. Rationale. Rapid shifts in glucose and fluids during DKA treatment can cause cerebral edema, a life-threatening emergency requiring immediate intervention. Question 42. A client with acute pericardial tamponade has muffled heart sounds, JVD, and hypotension. Which intervention is priority? A. Administer diuretics. B. Prepare for pericardiocentesis. C. Apply oxygen. D. Obtain chest X-ray. Answer. B. Prepare for pericardiocentesis. Rationale. Cardiac tamponade requires immediate removal of pericardial fluid to restore cardiac output. Question 43. A client with status epilepticus continues seizing despite 2 doses of IV lorazepam. Which prescription should the nurse anticipate implementing next? A. Administer IV phenytoin. B. Provide oral valproate. C. Apply restraints. D. Obtain EEG. Answer. A. Administer IV phenytoin. Rationale. After benzodiazepines, anti-epileptic medications such as phenytoin are administered to stop persistent seizures. Question 44. A client with severe hypothermia, core temperature 30 degrees Celsius, 86 degrees Fahrenheit, develops ventricular fibrillation. Which action is priority? Immediate defibrillation. Warm the client first. Administer epinephrine. Insert Foley catheter. Answer. Immediate defibrillation. Rationale. Ventricular fibrillation is life-threatening and requires immediate defibrillation even in hypothermia. Question 45. A client with severe preeclampsia has BP 198/112 millimeters of mercury and reports visual disturbances. Which action is priority? Administer IV magnesium sulfate. Administer IV hydralazine. Encourage ambulation. Obtain urine sample. Answer. Administer IV hydralazine. Rationale. Critically elevated blood pressure increases risk of stroke. Immediate antihypertensive therapy is required. Question 46. A client with acute transfusion reaction develops hypotension and bronchospasm. After stopping the transfusion, which action is priority? Administer epinephrine. Restart the transfusion slowly. Obtain blood cultures. Administer iron. Answer. Administer epinephrine. Rationale. Severe transfusion reactions with bronchospasm indicate anaphylaxis. Epinephrine is first-line treatment. Question 47. A client with bowel obstruction suddenly reports severe abdominal pain with rigid abdomen and absent bowel sounds. BP is 82/44 millimeters of mercury. Which action is priority? Insert NG tube. Prepare for emergency surgery. Administer laxatives. Encourage ambulation. Answer. Prepare for emergency surgery. Rationale. Findings suggest perforation and peritonitis. Immediate surgical intervention is required. Question 48. A client with ARDS on mechanical ventilation suddenly has oxygen saturation drop to 78% and high pressure alarm sounds. Which action should the nurse take first? A. Increase FiO2. B. Assess for kinks or obstruction in tubing. C. Call respiratory therapy. D. Administer sedative. Answer. B. Assess for kinks or obstruction in tubing. Rationale. When a ventilator alarm sounds, the nurse should assess the client and equipment first before changing settings. Question 49. A client with massive hemorrhage receives multiple blood transfusions and develops oozing from IV sites and prolonged clotting times. Which complication should the nurse address first? A. Hypocalcemia. B. Disseminated intravascular coagulation. C. Hyperkalemia. D. Fluid overload. Answer. B. Disseminated intravascular coagulation. Rationale. Massive transfusion can trigger DIC, leading to uncontrolled bleeding and requires immediate intervention. Question 50. A client in septic shock remains hypotensive, BP 80/46 millimeters of mercury, MAP 58 millimeters of mercury, despite adequate fluids and maximum norepinephrine infusion. Which prescription should the nurse anticipate implementing next? A. Discontinue vasopressors. B. Add vasopressin infusion. C. Reduce IV fluids. D. Administer oral antibiotics. Answer. B. Add vasopressin infusion. Rationale. Refractory septic shock may require addition of a second vasopressor, such as vasopressin, to maintain adequate perfusion and prevent multi-organ failure. You just walked through 50 of the hardest Nclex questions students constantly struggle with. If some of those questions made you pause, think twice, or even change your first answer, that's actually a good sign. The Nclex is designed to challenge your clinical judgment, not just your memory. Remember, the exam is not asking what do you know, it's asking what will you do as a safe nurse. The more you practice questions like these, prioritization traps, subtle safety risks, tricky delegation choices, and confusing clinical presentations, the sharper your decision-making becomes. If this breakdown helped you think like a real Nclex test taker, make sure you like the video, comment which question almost fooled you, subscribe to MCQs Master 101 for more high-level Nclex drills, critical care questions, and exam-level case studies. And remember this before your exam. Slow down, read carefully, trust clinical priorities, and never ignore patient safety. I'll see you in the next Nclex Mastery session.